Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll discuss about the anatomy of stomach. So first is the introduction. The stomach is also called the gaster in Greek, which means the belly or venter, from which we have the adjective gastric applied to the structure related to the stomach organ. Stomach is an important organ and is the most dilated portion of the digestive system. Next is the definition. So the stomach is a muscular bag forming the widest and most distensible part of the digestive tube. It is connected above to the lower end of the esophagus and below the duodenum. It acts as a reservoir of food and help in digestion of carbohydrates, proteins and fats. Next is the location. So the stomach lies obliquely in the upper and left part of the abdomen, occupying the epigastric, umbilical and left hypochondrial regions. Most of it lies under cover of the left costal margin and the ribs. Next is the shape of the stomach. So the shape of the stomach depends upon the degree of the tone of its muscles and tone of the muscles of the body. In normal active person, that is ethnic, its shape is somewhat J-shaped. In thin or tall person, that is hyposthenic persons, its shape is J-shaped. And in broad or strong and very active persons, stomach shape is horizontal. So the shape of the stomach can be studied in the living by radiographic with the barium chloride. Next is the size and the cavity. So the stomach is a very distensible organ and it is about 25 centimeter long and the main capacity is 1 ounce, that is 30 ml at birth, and 1 liter 1000 ml at puberty, and 1.5 to 2 liter or more in adults. Next are the external features. The stomach has 2 orifices or 2 opening, 2 curvature or 2 border, 2 surfaces and the 2 parts. So first external features are the orifice. So stomach has 2 orifices. So first is the cardiac orifice, which is joined by the lower end of the esophagus. It lies behind the left 7th costal cartilage, 2.5 centimeter from its junction with the sternum and at the level of vertebrae T11. Second is the pyloric orifice, which opens in the duodenum. In an empty stomach and in the spine position, it lies about 1 to 0.2 centimeter to the right of the median plane and at the level of lower border of vertebrae L1 or transpyloric plane. Its position is indicated on the surface of the stomach A by a circular groove. Pyloric constriction produced by underlying pyloric sphincter, which feels like a large firm nodule. B is by peripholic vein, which lies in front of the constriction. Next are the 2 curvature of the stomach. First is the lesser curvature. So the lesser curvature is concave and forms the right border of the stomach. It provides attachment to the lesser omentum and the most dependent part of the curvature is marked by the angular notch or incisura angularis. Second curvature is greater curvature. So the greater curvature is convex and forms the left border of the stomach. It provides attachment to the greater omentum, the gastrospalic ligament and the gastrophrenic ligament, and it is 5 times longer than lesser curvature. Thank you.